Good evening. Today we're going to be talking about dementia. Every year, almost 10 million new cases of dementia are recorded. Dementia is a general term used to refer to the loss of language, problem solving, memory, and other cognitive abilities that are extreme enough to interrupt daily life and independent life. The term dementia covers a vast variety of medical conditions, for example, Alzheimer's disease. Unusual changes in the brain bring about disorder characterized under the overall term dementia. These changes initiate a reduction in thinking skills and influence human feelings, relationships, and behavior. Dementia is a disorder that are characterized by a deterioration in behavior, thinking, memory, and the capacity to carry out daily chores. Although this condition mainly affects the older population, it is an abnormal stage in aging. Globally, about 50 million people have dementia, and approximately 10 million cases are registered yearly. Throughout the world, Alzheimer's disease is the main contributor to dependency and disability among the older population. This condition affects people economically, physically, socially, and psychologically. It impacts not only the disease recipient, but immediate families, society at large, and their carers. Approximately 60 to 80% of dementia cases are brought about by Alzheimer's disease. The second most common, being cause of dementia, is caused by the blockage of blood vessels and microscopic bleeding of the brain. This is known as vascular dementia. Several states of mind have been identified to be causing signs and symptoms of dementia. For example, reversible symptoms like vitamin deficiencies and thyroid problems. Often, dementia is mistakenly considered as senility, reflecting the previously widespread, however very incorrect belief that extreme mental retardation is a normal stage in aging. Some signs and symptoms of dementia. Some those people who have dementia always have trouble remembering and thinking that influences the capacity to manage their lives. For example, having problems with short-term memory, having issues keeping track of things, having issues with complex but obvious tasks, having issues with planning and organizing, difficulty with motor functions and coordination, disorientation and confusion, difficulty with spatial and visual abilities, anxiety and depression, difficulty in finding words and communication, having trouble traveling a known location, hallucinations, inappropriate behavior, flawed reasoning, and difficulty in problem solving. There are some general causes of dementia. It is caused by the loss or damage of nerve cells that are linked to the brain. Dementia affects people differently depending on the brain section that is damaged, therefore showing us different symptoms. Some being traumatic injuries to the brain resulting in concussions, road incidents, and falls. Diseases that affect the central nervous system, such as HIV and meningitis. Vascular disorders that interfere with the normal circulation in the brain. Prolonged consumption of alcohol and excessive drugs can also be a risk factor. There are some main risk factors in dementia. The first being age. The older you get, the more likely you are to get dementia as a result of another disease. The second being genetics. If you have parents or grandparents that have had dementia, you are much more likely to get dementia yourself. Third being sex. Males are much more likely to get dementia. Fourth, lifestyle. Those with a higher BMI and a lack of physical activity, and also those who do a lot of drugs, smoke a lot, and drink excessive amounts of alcohol are much more likely to get dementia when they're older. There are 7 stages of dementia. The first, no impairment, yet a test may be optimistic. The second, very middle decline. The patient shows slight changes of behavior, but still independent. Third, middle decline, characterized by a change in reasoning and thinking challenges. They may have trouble with planning and may tend to repeat themselves. The fourth is moderate decline. They show challenges in planning and recalling recent events and may have problem traveling and handling with monetary assets. The fifth is a moderately severe decline. A patient at this stage will not be able to remember familiar figures like their phone numbers and even grandchildren's names. They often confuse time and days and weeks. At this stage, the patient is no longer independent. Sixth, severe decline. Patients start forgetting the name of their spouses. They need to be directed to the washroom, restroom, and assisted during meals. Also, there is intense emotion and personality changes. The seventh is a very severe decline. They are not in a position to express their emotions and thoughts, and they are not independent at all and must be assisted in doing everything. There are some ways to treat dementia, and there have been some advancements made in recent years. The first way to treat dementia is through prevention. Doctors treat dementia by treating the disease that causes it. An estimated 20% of the infections caused by dementia are treatable. The following are causes of dementia that doctors consider reversible: excessive drinking of alcohol and use of drugs, brain tumors, low-level blood sugar, a condition known as hypoglycemia, HIV, reduced thyroid hormones such as hypothyroidism, metabolic imbalances such as vitamin B12 deficiency, clotting of blood under the outer layer of the brain. There are also other forms of dementia that can be managed partially, but cannot be reversed, as they get worse day by day. These include vascular dementia, Alzheimer's disease, Pick's disease, and Parkinson's disease. Regular exercise and neuroprotective therapy reduces the risk of this condition worsening over time. Recently, there have been some advancements in the treatment of dementia. The Alzheimer's Society investigators are doing continual research on dementia. Society has moved forward to new treatments, going towards preventative measures and the best way to assist patients with dementia. The current developments in dementia research include Jelly Drop, a fascinating new invention that assists to combat dehydration in dementia. The Alzheimer's Society is working on introducing this into care homes and those with dementia. It's a sugar-free sweet. It's 95% water with electrolytes, and they can eat it as a result of staying hydrated, as they often forget to have enough water. Second, identification of another type of dementia. Society has identified late as a new brain disorder, possibly caused by the accumulation of a toxic protein, TDP43. It has similar signs to Alzheimer's disease and can often be mistaken for it. Third is the introduction of modern blood tests to diagnose Alzheimer's infections. Researchers have created a blood test that is 94% accurate in diagnosing Alzheimer's disease. Overall, scientists need to engage in extensive research to develop modern methods of managing and controlling irreversible conditions to reduce the extreme conditions of dementia. Continued research will enable scientists to develop new approaches in diagnosing the disease early and manufacture drugs that respond faster to dementia. The continued study may develop more preventative measures to minimize new cases registered every year. Thank you.